Hi, everyone. Thank you for joining our Health and Environment series from the Wisconsin Environmental Health Network. We are waiting for everyone to join the webinar and let the numbers tick up here. While we are waiting, we want to thank our many generous series sponsors for allowing this annual event to happen once again this year. It's been amazing as always, and we are thankful as always. A special shout out to SSM Health for allowing us to provide continuing medical education credits for this series. We are very, very thankful to be able to provide that educational experience for those professionals. So thank you. And those numbers are still ticking up, but we will just get started a little bit about WEHN. So WEHN is the Wisconsin Environmental Health Network. It is the environmental arm of Physicians for Social Responsibility Wisconsin. I have our lovely website up there. I encourage everyone to follow us on Facebook and Twitter to stay up to date on our news and upcoming events. WEHN is a group of health professionals and concerned citizens and grassroots organizations all concerned about protecting public health and protecting our environment. We provide opportunities like this of educational resources. We provide action alerts of places where you can do advocacy work, such as the upcoming Line 5 draft environmental impact statement and make comments on upcoming events. We provide strong statements of providing strong rules and regulations that protect public health in our environment. So at WEHN, we are thankful for your support and hope you can join us, and also encourage you to learn more about what we do on our website. So please join us there. A little bit of what to expect from this presentation. I hope some of you are comfortable with Zoom by now, but we are in webinar format. So only panelists are visible. Attendees cannot speak or be seen. This event is being recorded. And will be on YouTube minus a little section of it. And to submit a question, please use the Q&A box on the bottom of your screen. It has two circular bubbles on it and says Q&A. You can actually submit a question at any time during the presentation, and we will try to address as many as possible at the end of Dr. Ward's presentation. So again, submit at any time. We'll try to address as many possible. If you're calling in, try to email us at wehnmail@gmail.com or press *9 when we're doing questions. And then to change the view of the speaker or the presentation, there's actually going to be a vertical slider on your screen, and you can adjust that back and forth to make the presentation bigger or smaller, or the presenter bigger or smaller. And then if you're joining from an app, this of course is going to be drastically different. And then I'm going to turn it over to Dr. Susan Davidson, who serves on our WIN steering committee, to introduce our speaker. Take it away, Susan.
Thank you, Hannah, and welcome to everyone. So I'm going to start with a not so fun fact. Did you know that Wisconsin is among 10 states where the rate of nitrate pollution in our drinking water is actually increasing? In a recent study, 32 of 35 wells in southwestern Wisconsin were polluted by human contamination, by fecal contamination. And to make matters more complicated, in November 17th, 2021, about 4 months ago, the Wisconsin Department of Natural Resources announced that it will abandon efforts to develop new public health protections meant to reduce nitrate pollution through improved practices for the application of manure and commercial fertilizer. And what happened is the Department of Natural Resources was well on their way to making tighter regulations on nitrates, and certain special interest groups interrupted that process. So our talk tonight on nitrates and health is very, very timely and very appropriate for our state. We are so happy to have Dr. Mary Ward with us. She is a senior investigator in the Department of Occupational and Environmental Epidemiology in the Division of Cancer Epidemiology and Genetics at the National Cancer Institute. Her research focuses on environmental causes of cancer with special emphasis on nitrates in drinking water and pesticides in relation to the etiology of childhood leukemia, non-Hodgkin's lymphoma, gastrointestinal cancers, and thyroid cancers. Dr. Ward has been very distinguished and very active, and you can see her work on the slide in front of you. She is known as a great interdisciplinary collaborator and has won awards for women leadership in women's science and mentoring. She received her master's in ecology at the University of Tennessee and doctorate in epidemiology at Johns Hopkins. Dr. Ward, thank you so much for joining us tonight.
Thank you. Thank you for having me. I'll just share my slides now. Okay, here we go. Well, thank you for that very nice introduction, and it's a pleasure to be here. I'm going to be talking to you today, just really giving an overview of health effects, what we know about health effects related to ingestion of nitrate through drinking water. First, I'll start with just an overview of my talk. I'll be giving some background on the biologic effects of ingesting nitrate at higher levels in drinking water within just one slide on diet, because that's another source. Talking in relation to the relevance for methemoglobin formation and N-nitroso compound formation, which is relevant for cancer and for birth defects. And then finally, a little bit about thyroid disease and how nitrate affects thyroid hormones. So then the health effects I'll be covering are methemoglobinemia, or sometimes called blue baby syndrome, and that's what the regulatory limit for nitrate in public water supplies is based on that health outcome. So an acute health effect. The other health outcomes, which are more chronic health effects, are include chronic health effects are adverse reproductive outcomes, cancer, and thyroid disease. So that's just a little bit of an overview and some background. I think most of you all know that nitrate in drinking water comes mainly from agriculture, from nitrogen fertilizers, as well as animal waste. And of course, human waste can also be a source. So there's a picture here on the right of a large animal, confined animal feeding operation and associated manure lagoons that can be important sources of contamination of our water supplies. So the regulatory limit called the maximum contaminant level, that's regulated by EPA under the Safe Drinking Water Act. It's 10 milligrams per liter as nitrate nitrogen, only counting the nitrogen in that nitrate molecule, NO3. And that's how it's expressed in the USA. And there's some confusion in the literature on this, so I'd just like to clear this up front. In the EU and some other countries, the WHO guideline for nitrate is 50 milligrams per liter as nitrate NO3, and that's almost the same, really about equivalent. 10 milligrams as nitrate nitrogen is closer to 45 milligrams as nitrate, the ion, but very similar regulatory limits. So we know that the people in the United States who have the highest exposure, and this map on the right is modeled estimates, but based on actual measurement data from the US Geologic Survey. We know it's residents of agricultural areas who have the highest exposure. You can see Wisconsin here, and Iowa, parts of the Central Valley, Eastern Washington State, Southeastern Pennsylvania have elevated levels. And it's really the people using private wells who have the very highest exposure. And there's about 13 million private well users in the United States. And that's partly because of their location near sources of nitrogen, but also because they're not regulated like public water supplies are. So it's up to the homeowner, the onus is on the homeowner to measure the nitrate and treat it if it is elevated. So as a result of them not being regulated, private wells, there's very little measurement data available. So it makes it more challenging to study that population using private wells for the drinking water. So moving along to, I promised one slide on diet. Diet is also a source of nitrate. There are some vegetables that have very high levels, including green things that are very good for you, like green leafy vegetables, celery and beets and rhubarb. It's shown here in this graph to the right, kind of the relative levels. There's rhubarb, I think that's watercress. But these vegetables also contain vitamin C, polyphenols, and other antioxidants. And I'll explain in a minute why that's important. But they inhibit the formation of nitroso compounds almost completely at high enough levels. Nitrate from diet has been shown to have beneficial effects on the cardiovascular system through the formation of nitric oxide. And this benefit has actually resulted in a whole kind of more than a cottage industry, an actual industry of supplements of high nitrate, for example, beet juice that's used for athletic performance, to improve athletic performance. But these have not been evaluated. These supplements have very high nitrate levels, and they haven't really been evaluated for to see how if nitroso compounds are being formed when people ingest these. And then finally, you've heard about nitrate and nitrite being added to processed or cured meats, and ingestion of higher levels of cured meats, processed meats, has been consistently linked to an increased risk of colorectal cancer as well as some other cancers. So moving on to just nitrate itself is not a carcinogen. And as I said, it can have some beneficial effects on the cardiovascular system, but it's ingested and very quickly is absorbed in the upper GI, in the small intestine into the bloodstream, and then through an active transport system, it's excreted into saliva. And the oral bacteria, part of the oral microbiome, convert nitrate to nitrite, which is a very reactive molecule. It's swallowed, and then in the stomach, it reacts with stomach acid to form nitrosating agents that react with amines and amides, which are common in our diet, like proteins, meats, and fish, to form these NOC, or that's just shorthand for nitroso compound, a class of compounds. And this reaction can be increased in the presence of heme iron that's found in red meat, but not white meat, and decreased, as I mentioned, in the presence of antioxidants like vitamin C. So we know when you ingest nitrate through diet, you don't get a lot of nitroso compounds formed because of the fact that it's coming along with all these antioxidants when it's in the form of vegetables. So there's been some human studies of nitrate ingestion, which are very revealing in terms of understanding kind of the mechanism and role of nitrate in various health outcomes. So it was demonstrated very early on that there was a direct relationship between nitrate ingestion and the conversion of nitrate that is ingested to nitrite, which is shown here on this figure to the right. So on the x-axis, it's the proportion of nitrate reduced to nitrite in the mouth by the oral bacteria. And that's directly related to the excretion of N-nitroso compounds. In this feeding study, they give people a non-carcinogenic amine, which is proline, which reacts with the nitrosating agents formed by nitrate, and can be measured in urine. It's excreted in urine and can be measured in urine. So what I wanted to point out about this slide, though, is that there's a range of, for the same exact dose of nitrate and the amine source, there's a range of formation of nitrosoproline concentration, and a range of that's directly related to the range of the amount of nitrate that's reduced to nitrite. So this is probably our inter-individual variation in our flora in our mouth, our oral microbiome. And really just in the past 5 years or so, we've been able to measure the oral microbiome and really understand there's many different species that can reduce nitrate to nitrite. They reside on the back of our tongue. So this is an important thing for future studies, to be able to characterize that variation in individual variation in that reduction of nitrate to nitrite. And some other studies, also again, older studies, have looked at people drinking different levels of nitrate in their well water and how that relates to the formation of nitroso compounds as measured in their urine. So in 2 studies where they looked at people on well water that was above 10 milligrams per liter, above the regulatory limit, they saw that drinking that high nitrate water did increase the formation of nitroso compounds in the urine compared to people drinking lower nitrate water. But in one other study up in Canada, they didn't see a relationship when levels were below half the MCL of 5 milligrams per liter. But these really aren't a lot of studies, and there really needs to be more done to kind of characterize the variability in nitroso formation that I talked about due to the oral microbiome, and just what is predictive of the excretion of these compounds, particularly at levels that a lot of people are exposed to now between 5 and 10 milligrams per liter, or even slightly above 10. So why we care about this is that these nitroso compounds are known to cause cancer and birth defects. And this is mostly based on animal data. I'll be going over the health studies later. But there's been over, nitroso compounds are the sort of catch-all term or class of chemical that includes nitrosamines and nitrosamides, which you may have heard about. But there's over 300 individual compounds that have been tested in animals, and over 90% have been shown to be carcinogenic in 1 or more species. They've been tested in 39 animal species, including non-human primates. So it's unlikely that humans are not susceptible to nitroso compounds causing tumors in our body as well. They cause tumors in many different organs, including the lung, digestive tract, bladder, kidney, ovary, and thyroid. And we know that in utero exposure, these compounds can cross the placenta, cause congenital malformations, especially of the central nervous system, where when the neural tube closes in the first trimester, that is thought to be a particularly vulnerable period, and they can cause neural tube defects. Most of the evidence is for that. So I'm going to start back though with my overview, my outline that I talked about, and that was starting with methemoglobinemia, that acute effect, which the regulatory limit is based on. So, whoops, I'm sorry, I went backwards. There we go. So back in 1945, it was an astute pediatrician in Iowa, at the University of Iowa, I believe, who published this report in the Journal of the American Medical Association that really raised the profile, or the awareness of the importance of well water, contaminated well water, in causing blue baby syndrome. So he reported 2 infants who had been breastfed for a while and then put on bottle infant formula made with well water. And this caused this cyanosis, and fortunately it can be reversed by administering methylene blue. But what happens is that the infants up to the age of 6 months are particularly susceptible because they cannot reduce methemoglobin, which is formed when it binds to nitrate binds to hemoglobin. They cannot reduce it back to hemoglobin very well because their enzyme systems are not mature. So this methemoglobin interferes with oxygen transport, especially when levels are greater than about 20%, and death can occur when it's over 50%. So back in the early 50s, after this was brought to the attention of public health practitioners and physicians, there was an investigation of 279 cases across 14 states, where they actually went and measured well water and investigated the causes of these cases of methemoglobinemia related to nitrate ingestion. So they found that there were no cases below 20 milligrams per liter as nitrate nitrogen, and this was the basis for setting the maximum contaminant level at 10, or basically or roughly half that level at which they saw no cases. So it's not a particularly conservative limit in that sense, in that other MCLs are actually include a larger safety factor, I guess you would call it. And then more recently, still it's been a while, 2000, there was a study or a report really in the literature from Wisconsin, where there was, it was reported in this paper that was published in 2000, Environmental Health Perspectives by Linda Nobelock and colleagues, that from the Wisconsin Department of Health, that there were 2 cases. One was at levels of 27 milligrams per liter, so not a whole lot above the regulatory limit, with no evidence of bacterial contamination, because that has been hypothesized and actually shown to be also a cause of methemoglobinemia. To my knowledge, I just did recently another search of the literature, and I haven't found any other reports in the United States in the published literature. But this is an ongoing public health problem in areas of Eastern Europe, the Gaza Strip, and Morocco. There's reports in the literature of ongoing cases of methemoglobinemia post-2000, the century. So that's what I have for you about methemoglobinemia and sort of the background for why we have this regulatory limit. So moving on to talk about adverse reproductive outcomes, I'm going to be talking about spontaneous abortions, a few studies on that, and then most studies have looked at congenital malformations or birth defects. There's really very few studies of other outcomes like both low birth weight and preterm birth. So the studies of spontaneous abortion were kind of prompted by these observations that high maternal methemoglobin levels can cause abortions in lab animals, it was known, as well as this was observed in livestock that were eating high nitrate sources really by accident. And in 1996, there was a CDC report, the Morbidity Mortality Weekly Report, of a cluster of spontaneous abortions in rural Indiana. And these were included women who were on private wells. It was determined later they were all on private wells where the nitrate levels were greater than 20 milligrams per liter. One of these women had had a healthy baby before she moved to this private well where the levels were elevated. So when they determined that they were drinking high nitrate water, they all switched to low nitrate water sources, and most of them went on to have healthy live births. So while not an actual formal epidemiologic study, it was fairly compelling evidence that at least at levels that these women were exposed to, there may be a link to spontaneous abortion. And there was a study in Massachusetts, an epidemiologic study, that didn't see an association with levels, but they were all below 5 milligrams per liter nitrate nitrogen, women on public water supplies. Now there's been a total of 6 studies of central nervous system malformations. This is the most well-studied adverse reproductive outcome that I'm going to focus on this. They were studies that were conducted in Australia, Canada, California, Texas, and Iowa. And 5 of these 6 studies did see an increased risk of CNS defects of either as a group or one or more type of central nervous system defect. And 4 of the 5 found effects at levels that were below the current maximum contaminant level of 10 milligrams per liter. Now, 2 of these studies, were all case control studies, because this is a very rare outcome, fortunately. 2 of the studies by Jean Brender, first one was conducted only in Texas, and the second one was conducted in Texas as well as Iowa, where the National Birth Defect Registry covers those states. She had observed a 2-fold increased risk in neural tube defects in the first study. But the highest risk, interestingly, was for women who had high nitrate in their drinking water and who also took prescription or over-the-counter drugs that have an amine group that can form nitroso compounds. So they call them nitrosatable drugs. The amine source was present with the drinking water nitrate. And then this study she did later in published in 2013 that expanded to Iowa, she's found a similar twofold increased risk in specific defects. It was a larger study, so she could look more in detail at specific defects. And the highest risk, again, were for women who had high total nitrate from diet and drinking water combined, as well as used nitrosatable, some type of drug that had this nitrosatable characteristic during their pregnancy. So in summary, 5 of the 6 studies found positive associations with central nervous system defects, 1 or more. And for 4 of these studies, the nitrate concentrations were below 10 milligrams per liter. Okay, moving on to cancer, which is the area that I study. In 2010, the International Agency for Research on Cancer published a monograph, which is basically an expert group who gets together and reviews the evidence for whether something is a chemical or a behavior, it can be smoking, whatever, is a carcinogen in humans. So they concluded that nitrate and nitrite, when ingested under conditions favorable for endogenous nitrosation, was probably carcinogenic to humans, and that was considered 2A. So a known human carcinogen is 1, so 2A is the next level down. So this was based on animal studies that I talked a little bit about, that many of these nitroso compounds are carcinogens and cause tumors at many different cancer sites. Also based on this human mechanistic studies that I talked briefly about, just a few of those studies. In terms of the epidemiology studies, there were no studies that showed a relationship with ingestion of dietary nitrates, and nitrate coming from mostly from vegetables. So they were null, showed no relationship to cancer in any study. For drinking water nitrate, it was considered the evidence was inadequate, and that was because there were very few studies of specific cancer types. The exposures were mostly based on the population using public water supplies, so people exposed below the MCL largely. And historic exposures were not always evaluated in the early studies because there weren't even public data back in the day before the 1980s, and factors affecting endogenous nitrosation were not always considered. So that was the state of things in about 2010. This slide, I'm not sure if you can see this across the top. There's trying to get rid of it. There we go. This slide summarizes the case control and cohort studies of drinking water nitrate and cancer. And these are studies designs that are really considered the strongest, where we have individual information on exposure, as opposed to area level estimates and looking at cancer rates. So this is actual individual estimates for everyone in your study. And this shows the cancer first, and then the number of studies, and then in parentheses, the number of studies that were positive, showing a positive relationship with higher nitrate ingestion through drinking water in at least either overall or at least one subgroup. For example, those who had lower vitamin C intake, but high nitrate intake. So the strongest evidence to date, or in terms of cancer sites. I should mention that these are cancer sites for which there's been at least 2 studies. So colorectal cancer has been studied the most. There are 5 studies, these individual exposure assessment type studies, 4 of which were positive. There's some evidence for bladder and kidney with 2 positive studies, 2 out of 2 for kidney. For childhood brain tumors, there's 2 positive studies of those that have looked at it, of the 2 that have looked at it. And then recently there's been studies of brain cancer in adults that have largely been null, but there was recently one study in young adults that was positive. So they're just giving you a flavor for what's been studied and what's been found in these stronger study designs. In the past, there were quite a few studies of stomach cancer that were mostly what we call ecologic, where you're looking at area level estimates of exposure, and those often also showed a relationship. This slide shows the studies of colorectal cancer. And some studies looked at rectal cancer separately from colon, and a few just looked at them combined as well, or only presented data that way. This McElroy study is actually from Wisconsin. And you can see that the overall estimate in this meta-regression is borderline significant for rectal cancer. It is statistically significant for colon cancer. It's greater than 1, meaning the risk is for high exposure is increased. And for studies that looked at colorectal cancer combined, it's also significantly increased. So now I'm going to just talk about one of our studies, just kind of walk you through how we do some of these studies. And this is a cohort of older women, postmenopausal women in Iowa who were enrolled in this cohort in the late 1980s through driver's license records. That's how they initially contacted them, invited them to participate. So 73% of these women who participated used public water supplies, and 25% used private wells. Very few used bottled water. We linked public water supply monitoring data, and in Iowa for nitrate, that went back very far because of this concern about blue baby syndrome. There were surveys back in the 60s of nitrate in public water supplies. So we linked these data up to the enrollment residence where women were living at the time of enrollment. They told us whether what their drinking water source was. We also had information on disinfection byproducts, trihalomethanes, which started to be measured in the 80s. They lived at 473 different cities, different water supplies, and we also had an estimate of the duration they were at that residence. And so we linked this public data by duration to compute an average level over the years they lived in the residence for both nitrate and trihalomethanes. And we also computed a metric that was the number of years that they lived at a residence that had a level that was half the maximum contaminant level or above. So just a little different way to describe the exposure. This is a very stable population. 82% had used their water supply at enrollment more than 16 years. So the first paper that was published on the cohort on drinking water nitrate was Pete Weyer in 2001, and he published all the major cancer sites. He had 100 ovarian cancer cases and 57 bladder cancers. And this was after about a little less than 10 years of follow-up of these women. So these were newly diagnosed cancers after enrollment. And he found these are the sites he saw an increased risk. He saw an elevated risk for ovarian cancer and also a suggestion of an increased risk if among women who use private wells. And we didn't have any nitrate measurements, so this was compared to the lowest quartile of public water levels, nitrate levels. Also, he saw an increased risk for bladder cancer, almost threefold increased risk, and not really evidence of an increase for private well users. There was no association for these other sites here that he looked at that time. So in a number of years later, we've done some updated analyses of these cohorts in collaboration with our Iowa collaborators. And I'm going to show you some, talk about the results for ovary and bladder cancer. So after 20 years of, greater than 20 years of follow-up, there were 315 ovarian cancer cases and 263 bladder cancers. We also saw increased risk again. We updated analyses of colon, rectum, pancreas, and those were showed no associations like they had in Pete Wyer's analyses. We did find an increased risk of kidney cancer in the highest exposure group that hadn't been seen before. And in this follow-up, we had really improved exposure assessment because we had information on trihalomethanes, the important risk factors for bladder cancer. We estimated dietary nitrate from a food frequency questionnaire, nitrate and nitrite, so we could look at that. And then we looked at factors affecting nitroso compound formation that I've talked about, like vitamin C and red meat. So these were the results for ovarian cancer in that additional, with the continued follow-up. You can see there was an increased risk with increasing quartiles of nitrate level in the public water supply. And the women who were using private wells also had about a 50% increased risk compared to this comparison group, the referent category of women who were drinking low nitrate water, public water supplies in their public water supplies. And this was adjusted for a number of risk factors for ovarian cancer. And now I want to show you really, I think, compelling evidence for why we need to stratify by these factors that are related to endogenous nitrosation. When we looked at the women who had higher intake of vitamin C, we saw really no evidence of an association with the average nitrate level, and also for women on private wells. But when we looked among the women who had lower intakes, and these are not really that low, but we were just dividing the population into high and low based on what they reported as their usual dietary intake, we saw a very strong increased risk with the average nitrate quartiles, and also an increased risk for those using private wells, again, compared to that same reference category. And this interaction of drinking water nitrate and vitamin C was significant for these private well group. So just to summarize for cancer then, some limitations of studies of drinking water nitrate in cancer. As I mentioned, there's 5 studies, and the most consistent evidence is for colorectal cancer, but there's still very few studies of specific cancer sites and epidemiology. We like to see multiple studies in different populations showing us this similar kind of pattern in risk before we draw conclusions. The limitations of most studies is that private well users, who we know have the highest exposures, are usually not considered due to the lack of measurement data, like I showed you for the Iowa Women's Health Study, and factors affecting nitroso compound formation, which you really need to do a diet history to get at that, are not always evaluated. So we discussed this in a review, and I'll give the reference to this at the end of my talk, but we talked about the evidence through 2017, so more recent for cancer and other health outcomes. And finally, I wanted to turn to the last health outcome I was going to discuss, and that's thyroid disease. We know nitrate inhibits iodide uptake by the thyroid, and so it's a little different effect. Nitroso compounds can also cause thyroid cancer, but there's a direct effect of nitrate in inhibited iodine uptake, and this has been shown to lead to hypertrophy of the thyroid, and hypothyroidism. So that may be a mechanism for cancer development. There's been a few studies that have looked at nitrate in drinking water and hypothyroidism. There was a study in Slovakia that measured subclinical hypothyroidism in children by ultrasound and found that it was increased, the prevalence was increased among women who are on high nitrate water. The study I told you about, the Iowa Women's Health Study, we looked at self-reported thyroid disease in the women at enrollment, and women who had higher nitrate ingestion from diet and drinking water had a higher prevalence of hypothyroidism. And then there was a cohort of old order Amish in Pennsylvania where we estimated nitrate levels in their drinking water, and we found a relationship between, we had measurements of serum thyroid stimulating hormone, and we found a relationship with higher serum TSH, as well as subclinical hypothyroidism characterized or classified by their TSH level. I'm going to go over this quickly because I want to leave plenty of time for questions, but this is from the cohort of Old Order Amish, and just showing some screenshots from the geographic information system, how we estimated the nitrate levels in their wells, because we didn't have measurements on this cohort in the relevant time frame, but there were a lot of measurements in this area, in this 3-county area of southeastern Pennsylvania. So we looked at things like the rock formations, land use, karst density, and aquifer type, and worked with environmental scientists and modelers to develop a model to estimate that. And these are the results that I talked about, that subclinical hypothyroidism was not related to nitrate in men, but it was in women. Okay. So I'm going to move on and just end with some ongoing research that we're doing on nitrate in drinking water, as well as other water contaminants in the agricultural health study cohort. This is a cohort of about 90,000 farmers and their spouses in Iowa and North Carolina that's run by the National Cancer Institute, as well as collaborators at the National Institute of Environmental Health Sciences and EPA. About 70% of the cohort used private wells at their enrollment address. They were enrolled in the mid-90s. And we estimated nitrate in the private wells using random forest models. I'll just show you one slide about that, different models for Iowa and for North Carolina. And we linked in public water supply measurements for nitrate and disinfection byproducts. And we also estimated dietary nitrate and nitrite from a food frequency questionnaire that was at a second interview. So just a little bit about the model, kind of similar to what I showed you for the Amish study, but we had a lot more measurements. We were doing a statewide model. This is the data for Iowa, and we evaluated a lot of different variables, working closely with collaborators at the US Geologic Survey. So we incorporated land use, animal feeding operations, geology, and soils were just some of the top variables that were predictors of nitrate in the drinking water wells across the state. And you can see up in northeastern Iowa is an area of karst geology that was an important predictor, and you'll see that. And the next slide, animal feeding operation locations all over the state up in this vulnerable aquifer area, as well as very high concentrations in northwestern Iowa. So just to wrap things up, I wanted to just talk about a couple of research needs. I mentioned that we need to clarify the relationship between nitrate ingestion and nitroso compound formation in controlled studies, just to understand more what factors are important to consider when we do our epidemiologic studies. We think that probably the oral microbiome is one of those. And of course, it would be great to also incorporate biomarkers of exposure in studies when you have biologic samples. We should also look at other water contaminants and certainly do more studies in populations with the full range of exposure that would include populations using private wells. So I wanted to end by mentioning my collaborators at the National Cancer Institute, many postdoctoral fellows, and Rena Jones, who's a tenure track investigator, published some of the later publications. She's the first author. My US Geologic Survey collaborator, Tom Nolan, and others at University of Iowa, Minnesota, Mayo Clinic, and shout out to David Wheeler, who led the Iowa modeling paper for the agricultural health study, and Kyle Messier, who led the North Carolina modeling, and Jay Knuckles, who led the Amish modeling effort in the Amish cohort in Pennsylvania. So this is the reviews that I promised to mention, that we did an earlier review in 2005 and an update of that in 2018, looking at all different health effects, including cancer, of course. And then there have been a few studies published since that 2018 review that I wanted to list here. And thank you for your attention.